Laura, are we ready to get started? Laura, can you hear me? Well, good afternoon, everyone. I want to appreciate everyone and thanks everyone for spending their lunch with us. My name is Tony Smith from the Zimmer Biomet trauma team. I'm on the marketing team, and today we're going to talk a little bit about the external fixation and the external fixation and a new game-changing technology that Zimmer Biomet has recently launched. So to start off, we'll kind of talk about kind of the whole question of what is ExFix? And it's interesting when you think about it. There's many different types of external fixation. You'll hear it referred to as ExFix, just to shorten it, but actually, bottom line is all external fixation. What you'll see here is I have captured a couple different frames and what they look like. Sometimes you'll see just one frame, one bar, sometimes 2 bars. Sometimes it'll be circular, a number of different struts and rods throughout it. And then if you look at that bottom picture toward the right, you can see here that this is a longer one, and this doesn't have as many circles and struts as this one does, but you do have a number of different options there as well. And really what it comes down to is just really something that's going to try to help with stabilizing the bone. So this is going to be my earmuffs disclaimer. This is going to be, obviously, this is over the lunchtime time frame, and there might be, when I say might be, there will be some potentially graphic pictures. So if you're eating, if you have a weak stomach, I'd ask you to maybe turn away, and because we will have some pictures of when a patient needs to temporized as well. So the question is always to frame or not to frame. That is the question. And oftentimes when you look at it and you think about it, you think, when do I need to do that? Here's 3 different types of patients. What you'll see is on the first picture on the left, you can see how the skin looks, and really this really comes down to the skin. You can see how the skin looks. On the left, there as blisters. It's red. It's extremely red, and that's something where we want to respect that soft tissue, the skin, and we don't want to operate at this point. If you look at the picture in the middle, it's kind of questionable. We do see redness. We do see a lot of bruising, and this is one where it's very, very questionable. When you compare that to the picture on the right, that overall, that tissue and that skin looks pretty good. So in this situation, we could proceed on the picture on the right. We could go ahead and operate if we thought that patient needed that. But on the one in the middle, it would be questionable, and most, I should say, some surgeons would say, I'm not sure what that soft tissue with that skin looks like and how it's going to react. So they may want to hold off on operating, and this may be an example of when they would also use external fixation. So it really comes down to the kind of the classification of patients. They really try to look at that patient and they say, is this patient stable? Are they borderline, or are they unstable? And at the end of the day, it's all about, ExFix is just a way of temporizing the treatment, temporarily treating them, and then scheduling a definitive treatment at a later time. So I want you to think about this and think about this image, this picture that I'm going to talk about. So you're walking outside, it's 5 o'clock, you're getting ready to go home, and as you're walking outside, you're walking to your car, see a jogger that's out there running. I say this because I'm a runner, and this has happened to me a couple times where I'm not paying attention as well, and I get to come to oncoming traffic, and you might hear that you see the traffic, and that's when you start to pay attention. If the runner's not paying attention, I want you to think about a car coming by and hitting that patient, and think about that bumper hitting that bone. So if you think about the car hitting the person running, where is that front bumper going to hit that patient? Either going to be in the knee, in the femur typically, or right in the tibia. And as it hits that, it's going to be a lot of energy transfer from that car to the patient to that bone, okay? So as that car hits that patient, then that's where you start to think that's a lot of energy that's hitting that patient, and that's what causes that inflammation of the skin immediately. So typically when you're ExFixing a patient, it is going to be something that's going to be very high energy, and that high energy really causes that skin, soft tissue, to inflame and causes that swelling component to take place. In that situation, the literature shows that we should not be operating when that tissue is upset and that inflamed. Because nothing good can come of operating on that skin, because then you have to worry about taking care of the skin throughout that as well. So what the literature says is in those situations when it's a high energy fracture, the best practice is to go ahead and ExFix it. So ExFix it in a way of temporizing it. That basically holds the injury to length, and then you schedule the definitive treatment, whether you're going to plate it or you're going to nail it down the road. So you may schedule that for a week from today, or 2 weeks from today, or maybe even 3 days from today. But you basically come back and treat it at a later date when the skin has calmed down and it's a little bit more easier to deal with that skin as well. So kind of just talked about this a little bit, but it's basically when would you, indications for ExFix, patients in danger or polytrauma. An example of a polytrauma is for that same patient that was jogging, if a truck, if a big rig hits that patient, then you can imagine they're going to have a lot of internal damage as well. And when you think about the internal damage, whether it's head trauma, chest trauma, thoracic trauma, that's going to be a lot more crucial to treat right away. So in those situations, even if that patient also has a broken leg, femur, tibia, then you still want to stabilize that fracture, but you just want to stabilize it and then move to the more crucial items like the head, like the chest, and like the thoracic cavity. So you're stabilizing it and you're moving to the more crucial emergency treatments, and then you'll come back a week later or so to treat the fractures. So with a traditional ExFix system, like you see here, you can see that there's a number of different clamps, there's a number of different pins, there's a number of different drills, there's a number of different bars, there's just a host of other, just options here. These are the different bars. These are the different pins that you see here. These are the different drills. And then you have all these different instruments throughout here as well. So when you think about, the average hospital in the United States, they're not treating a lot of these all the time. So as they're coming into and looking at this, they're not comfortable always, and they may not have the right staff appropriate to walk through this. When you think about when does something like this happen, probably a lot of times, oftentimes this is happening at night at 2 in the morning or 11 at night, and you may not have your orthopedic staff that's ready to treat something like this at that time. You may have whether it's neurology staff there, and they're not treating many of this at all. So there's just a lot of factors that take place when you do this. So here's a video. We'll see if this runs of an example of what all goes into putting a system together. As you see this surgeon here, he's grabbing his clamps, he's looking at the rods, he's looking at the lengths of the rods. There's varying different lengths as you look at the rods. Then they start to have to put this together. This really becomes more of like a tinker system because you're really trying to build a construct. And if you're building one of these every 6 months or one of these every once a year, then you can see here all of this here. All of this, there's guesswork, there's challenges, there's recommendations, and you're trying to walk through this. You're grabbing the clamps, and if you think back, there were a number of different clamps to choose from. How do you know which one is the right one for the length that you're going for the size of the bars? Then they have to pull this because they're trying to get traction. They want to pull that bone out to length. Because if you don't pull that bone out to length, then you run the risk of shortening, and then it's going to be tough to get that length back as well. So here you see they have it stabilized in the femur, stabilized in the tibia here, and they're tightening it down as they pulled this to length. But you think about how many hands, how many people are in here that it takes to do this. And that's one of the other challenges is if it does come in late at night, you have the amount of people that you need to put this together and that are skilled enough to put this together. Then you have to tighten it, and you have to know what you're looking for from an X-ray perspective as well. So that's kind of what a traditional system looks like. And what you see here is that there's just a lot of moving parts. Anytime there's a lot of moving parts, you're increasing the amount of risk that's associated with this as well. And anytime you're introducing more risk to the case, then obviously that increases the overall pucker factor. So what Zimmer Biomet did is we kind of created a new system because we saw that there was an unmet need of just a lot of components. As you look at that picture, you look at that tray right there. What we came out with is a new system, which is a pre-packaged, pre-sterilized, pre-assembled kit that comes put together right away. It's really designed for the simplicity because it is sterile, comes sterile already, pre-assembled frame. And what you'll notice is that sterile pack disposable, so this is disposable, so from a cost perspective, this is going to be lower cost, pre-assembled, and it really addresses the common ExFix external fixation needs, all while meeting the economical demands of hospitals and surgeons. So we looked at that last video, we saw they had to put it together. There's a lot of sterility that's tied into this as well. And it's the amount of hands that it takes as well. You look at this video and how this goes, really it's a lot simpler when you start off. It's going to come in a sterile box. You open the box, it's no different from passing any implant off to the sterile field. It comes with 4 pins in the system. Really, this is the hardest part is just putting these 4 pins in. You drill the 4 pins, and it does have some placements of where you want to go with the pins. Then it gives you, there's 4 slots, 2 in the top, 2 in the bottom. You have that mobility there to put it wherever you want, but you can see that it's already pre-assembled, it's sterile packed. The amount of hands, you can see there's really one surgeon that's really manipulating this now versus 3 other people, 6 hands, oftentimes 4 other people that are trying to put this thing together. And this is what really helps with the simplicity of this system. This is also a lot more reproducible as well because you have everything in one place, one kit. So prepackaged, sterile, disposable. This system comes in 4 different frames. An ankle frame, which you see on the far right, a knee spanning frame, distal radius frame, and then a damage control frame, which is going to be for just a long bone kind of fracture, pre-assembled, and it does allow for it's going to be telescoping, and I think you saw him doing that, where you can get the length that you need, and it's going to be MRI conditional as well, like just about every other frame out there as well. When I talk about telescoping, you can see in this picture here, you can see that it does have the ability to move up and down based on the length that you need. To add to that, when you think about these ExFix frames, most of the times they are repetitive in the shape that they're building, and this is going to be that one frame that comes prepackaged, all ready to go. It is going to be lower cost because it is disposable, and what we're seeing across the board is that it's going to be roughly 25% less expensive than the average external fixation procedure. So if your hospital is concerned about cost, this is definitely a great option to go to. And this is across the board. We're in a number of different hospitals today, and across the board we're seeing at least that we're 25% off from a traditional external fixation frame. Also, how much does speed matter in your hospitals as well? What we've seen is that this is going to be a lot faster, because you think about that first video that you saw, the building of everything. So you're thinking about that OR time, the surgeon building it, whether it's the surgeon or the staff that has to build everything out. This, because it comes pre-assembled, sterile packed, and all you're doing is placing those 4 pins, it's going to help with time savings as well. Some studies show that OR time is roughly $100 to $150 a minute. And then also there's also the sterilization cost as well. And if that's something that's important to your hospital as well, this is definitely something to look into as well, because it is sterile packed, and so whether the surgical team is bringing it in from a different hospital or if it's on the shelf, it's ready to go right away. And it also eliminates the risk of holes in the blue wrap, the blue wrapping as well. I think we've kind of talked about this, re-sterilization, contaminated blue wrap. It kind of eliminates that concern. 75% faster from a time perspective, because you don't have to worry about trying to build that frame. And it also eliminates all the confusion. So if you think about the average hospital that's not doing a lot of these frames all the time, that's concerning for the OR staff, concerning for the surgeon, and anytime that everyone in the room is somewhat concerned, then tensions are up, and that patient may not be getting the best opportunity there. What this does is this eases the road for everyone. Everyone's a lot more comfortable with it because it's sterile packed, pre-assembled, and all you have to do is place the 4 pins, and that helps tremendously. Comes in 4 frames. Right now, there's only 2 frames that are available. The 2 on the left, the knee frame and the damage control. These are the only 2 that are available right now. The distal radius frame and the ankle frame will be available later this year. And that is everything regarding FastFrame. So I'll ask Laura if she can open the line for any additional questions. I'm going to be available for the next 2 hours to answer any questions, but if there's any questions, please let me know.
Yes, thank you so much, Tony. I really appreciate that. It was extremely informative, and I know some of our team members had the chance to see this, and we're very excited about it. So, yeah, let's definitely go ahead and open up the line.
That will unmute you to ask questions.
Yes, definitely, please. Anyone have any questions for them, go ahead.
Or you can text me. My cell phone number is 574-527-9343. Or you can send me a chat on the WebEx as well.
Tony, I have a question for you. How many SKUs are there with this system?
Can you hear me?
I can.
Yes.
Yeah.
Hello?
Perfect. Yep.
Any questions?
Tony,
were you able to hear the question?
I didn't hear the question. What was it?
I'm sorry. How many SKUs are included with this system?
Yeah, it's a great question. There's really one SKU per kit. So there's four different frames, and there's 4 SKUs there. There's 2 frames that are available right now, and that's the knee spanning and the DCO. So each one of those has one SKU that's affiliate.
Awesome. Thank you.
Yep.
Are these reprocessable?
These are not reprocessable. These are disposable. So, and that's what helped us with the overall cost, bringing the cost down as well. So these are disposable. So as they come in, then you can throw them right away.
Is there anyone else that would like to ask a question?
Here's a question that came to me via the chat line. When are these available for my account? These are available right now. The damage control, which is for the long bone fractures, and the knee spanning. The knee spanning is going to encompass the femur and the tibia. So anytime you have maybe even like a proximal tibia fracture, that's when you would use the knee spanning. But both of those are available now, and I'd say reach out to your Zimmer Biomet representative to make sure that these are available and on the shelf at your hospital. Or if you didn't want them on the shelf, you can have them just available for, if you just let your Zimmer Biomet representative know that this is a potential for use for the next fracture, they'll make sure that they have one available in their car or at the local office. Good question.
Perfect. And this entire presentation we've recorded on our WebEx, so it will be available on our website in probably about 24, 48 hours. So anyone that would like to reference it, you will be able to see it there and share it with your team members too. So any other questions?
Wonderful.
Otherwise, we will let you guys go and enjoy the rest of your day. Thank you again to the Zimmer team. We really appreciate you taking the time to share this with us. And we will see you all next month for our next 2020. Thanks so much. Have a good one.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you. Bye.